beats approximately 1 lakh times a day and pumps about 5 quarts of blood each minute, or 284 liters every hour.
So the heart is a muscle pump. It's almost the size of a fist, and it beats at 80 per minute, receiving blood, oxygenated blood from the lungs, and pushing it out to the rest of the body.
Valves open and close to allow blood to flow in and out of the heart's chambers, making the flow of blood throughout the body possible. Any disruption in this normal flow makes it difficult for the heart to effectively pump the blood.
When the heart contracts, the blood can't go backwards, it should only go forwards, and that's because of these valves. So these are one-way valves which allow the blood to go. From the left side of the heart, as the blood goes to the rest of the body, to our brain, is the main valve called the aortic valve. And this is the valve we're talking about, the connection between the pumping chamber of the heart and the rest of the body.
Aortic valve stenosis usually occurs after 70 years of age. As valves age, calcium builds up around the valve tissues, and these deposits can contribute to valve diseases by limiting the blood flow through the heart and by making the valve leaflets more brittle.
Most important symptoms of this aortic stenosis or narrowing of the aortic valve at whatever age it occurs is firstly breathlessness on exertion. So a person is unable to do his daily activities which he is used to because he gets breathless. Features of dizziness, chakkarana, which may suddenly go into a complete loss of consciousness. Symptoms of chest discomfort on walking, pressure on walking, inability to walk the full distance, and occasionally, or in rare cases, it also presents as sudden death.
In this catheter-based procedure, a physician makes a small incision, usually through an entry point in the leg, and guides the new valve into position to replace the failing aortic valve. The device then expands into place and takes over the original valve's function to enable oxygen-rich blood to flow efficiently out of the heart.
For those who have moderate to increased or severe risk at aortic valve replacement, TAVR is the alternative. TAVR is not the alternative for routine young patients having aortic valve replacement. Aortic valve replacement surgically is a very robust and tested out procedure. But when the risks of the procedure rise is when TAVR comes.
82-year-old Ori was a successful businessman and living life to the fullest before he got infected with a mosquito-borne viral disease. The diagnostic tests not only helped in treating Ori's viral infection but also detected a larger medical concern at the right time.
I got this infection of chikungunya, and I was admitted to the hospital. They take my echo. In the echo they told me that I have got this, one of my valve, the size has been reduced, so it has to be taken care of.
Despite living an active lifestyle, Ori began to suffer from shortness of breath and hence went for a consultation with a cardiologist. With subsequent tests later, Ori was diagnosed with acute aortic stenosis.
Ori is an 82-year-old man, quite active in fact, I must say he's a very young 82. But he started experiencing shortness of breath, which was really getting bad, to the extent that he now could not walk at all and was breathless, and even on walking. For that, the investigations were done, and the most common investigation is an echocardiogram of the heart. So when the echocardiogram of the heart was done, it revealed that one of his valves was severely blocked, a condition called calcific aortic stenosis. Calcific aortic stenosis is a disease which happens as an aging process in the body to some of the people, and the main valve which connects the heart to the rest of the body and is responsible for letting the blood flow through to the rest of the body, brain, etc., was actually so narrowed that the heart was pumping very hard against, but the valve was not opening, so the blood was not flowing to the rest of the body. It was getting congested and he was feeling breathless, and actually such a condition becomes a very serious condition for the elderly.
Ori was advised to undergo the procedure of transcatheter aortic valve replacement to treat his heart valve disease.
Before the procedure, you see, I was scared. I was worried how this procedure will get. There were so many bad thoughts will come into my mind. So I was worried like that.
We must remember that this decision of offering Mr. Ori TAVR procedure was not my advice or an individual's advice. It's the heart team which sits together and decides for the patient that if is he going to be really high risk for surgery? Is he suitable for surgery? Should we consider the other way, which is the transcatheter way to implant the aortic valve, and which would be the safest and the best procedure, giving Mr. Ori the longest term results?
It's been a few months since the procedure, and the TAVR technology is restoring Ori's heart valve back to its natural state. Ori is back to doing his regular chores, and this time it's a notch better than before. He is literally matching his son's pace while walking.
After the open heart surgery, there may be a lot of complications. There can be, he would have taken more than 6 months to recover, but after the TAVR, he was back to life within a week. He's now started going to office. It's been practically 3.5 months, and I can feel the change. He's back to his walks in the morning. He's not breathless anymore. He started going to the office, and I think he should be fine. In another 3 months, he should be recovered fully.
Ori's procedure went absolutely fine. But he did very well. He actually recovered rapidly. We had a small cut down through which we put the catheters up. That healed up very nicely. He is back to normally functioning, I say 3 to 4 days. He recovered fine and then got back to his complete fitness and activities, to the extent that he now walks 4 kilometers a day and is looking forward to every activity, including travels and all his fascinating intentions of doing very many things in his life.
An entrepreneur at heart, Ori is not only back to working with more enthusiasm and vigor, but is also breathing new life into all his business projects.